Well, first, the big news today. India has surpassed Brazil to become the second worst hit in the world by the coronavirus pandemic, with a daily spike of 90,802 cases, taking the country's tally past 42 lakh. This is the second consecutive day that the country has registered over 90,000 new infections in 24 hours. The positivity rate, which is an indicator of the prevalence of the highly contagious disease, stood at 12.6% this morning, which is very worrying. In fact, the positivity rate should ideally be below 5%. For India, it had gone below 10%, but now it's back up there. And India also reported over 1,000 deaths during this period. Now, the other big story as far as coronavirus in India goes, Bengaluru has reported its first case of alleged COVID reinfection at the Fortis Hospital in Bengaluru. A 27-year-old woman has been found to be the first confirmed victim of COVID reinfection. The woman, who has no history of comorbidities, was tested COVID positive in the month of July after she developed mild symptoms of fever and cough. She recovered well, according to the hospital, and then was discharged successfully after being tested negative for COVID. However, in a span of a month, she developed mild symptoms and has again been confirmed as having contracted the infection once again. Well, to talk more about this, first let's just take a look at what the government there in Bengaluru, what Dr. Sudhakar, the Minister for Medical Education, had to say.
In a span of 7 months, where there is more than 3.5 lakhs people who are infected with this COVID pandemic in Karnataka. Unfortunately, day before yesterday, it was reported in a private corporate hospital called Fortis. A 27-year-old lady, she has been reinfected in a matter of couple of months after she had recovered in the first stage. So this has been little, unfortunate, and I have already spoken to the concerned officials, and today I have called a meeting of the specialist team, and I would like to deliberate more on that. So let us see what the specialists will have to say. But world over, there are many reinfected cases that were reported. So in this particular case, I would like to understand when at the time of recovery, whether the antibodies were diagnosed and tested. If so, what will be the duration of the antibodies that will protect a person who was infected?
All right, so that's what the minister had to say, and he wants this entire issue investigated further. Also, a US doctor, Dr. Fahim Yunus, tweeted about this. He's somebody who's also been tracking the pandemic, and he called this a false alarm, saying reinfections can't be diagnosed by antibody levels. No genomic analysis was done in this case. Well, to talk more about the case, we're joined by Dr. Pratik Patil, infectious disease expert from Fortis Hospital. Also, Dr. Rakesh Verma, who is DGAH, Health Ministry, Government of India. Thank you so much, doctors, for joining us. Dr. Patil, first to you, if you could tell us more about this particular case and, what the minister there in Karnataka said, and also questions that have been raised about whether this is genuinely a case of reinfection or not.
Okay, fine. So, I understand there are doubts. I can explain the reasons why there are doubts and why still I would want this to be discussed. This is, the lady was a 27-year-old lady. She had an initial influenza-like illness, and she was tested positive after initial symptoms. And she had a mild illness. She recovered, and after recovery, we had a negative test done, and she resumed her life back. And it was nearly 1 month after recovery, and you can say around 1.5 months after the initial test. Initial illness, she developed her second set of symptoms of influenza-like illness. So this is the time when we investigated her further for COVID-19 again. We had done the antigen again. It was positive. We followed it with the PCR, that is a CBNAT. That was also positive. And at the same time, we wanted to know whether she had developed antibodies following the first infection. So these antibodies were negative, the IgG antibodies. Now, Subsequently, we had ruled out other respiratory infections by another viral PCR like influenza and RSV. That was negative. Now, I know that to confirmly say that this is a new infection, we need to have the genotypic sequencing, the whole genomic sequencing from the first as well as second virus, to know that there are two different viruses or two different
or whether
strains.
it's the same infection that was
Correct.
perhaps very subdued in the body that's just
Correct.
come up again after a month.
Yes, that's no. I have some other explanation for that, or we can discuss it here as well. Now, whether it is the same infection or different infection, obviously the previous sample is not available with the lab now, so we can't compare. So obviously we have the second sample stored with us, which we are trying to get a culture done in association with the help of NIV Pune. Second thing I wanted to, though I know that the CT value, the cycle threshold that is measured on the PCR machines, or whenever you do a PCR, there is a CT value that you must have heard about. So it was quite high in both the cases. So when
the
first
second
test
time also it was very high, which
yes,
means
it
it's a
was,
milder
no,
infection.
Not high. No. Sorry. It was high means the viral load was high. The
I
CT
see.
value on first test was 20. And during the second set of infections, it was 17. Now, I'm aware that CT value doesn't correlate with the clinical infection. But again, the chances that the second
though some people feel you should give a CT value that it gives like how much infection there is in the body. But let me just get in Dr. Rakesh Verma here. Dr. Verma, what do you feel about this entire case? And we do want the ICMR also to speak on this and see the reports.
Gargi, prior to this Bengaluru case, only 4 patients were reported to have reinfection. First case was from Hong Kong.
Yes.
2 cases were in Europe, one from a Dutch and a Belgian person, and 4th was a USA citizen. And incidentally, the case of Hong Kong and USA patient were very, very surprising because both were very young and they developed severe symptoms in first time as well as second time. In the Hong Kong patient, the RNA genome typing and was also analyzed. I must have to tell you what is this like. Just like we have got fingerprints, which can identify one person away from a different person. Similarly, genome typing is the way the RNA proteins are lined up in a particular sequence. So we can say this virus has got this kind of pattern and second virus had a different kind of pattern. So in the Hong Kong person, it was categorically established that the genome typing of the first infection was different from the second infection.
Right.
That answers to a query which said it was a subdued infection and re-erupted again. No. This was definitely...
No, I remember the Hong Kong case because the person came back from Spain and developed, he got the European strain or something like that of the virus. So he'd had it earlier in Hong Kong.
A person had two COVID-19 infections in a gap of about couple of 5-6 months. But in the USA patient, who is a young person of 25 years, had a recurrence or a fresh infection within a span of 1 month, and he is a robust, otherwise without any comorbidity like blood pressure, hypertension, diabetes and all kind of things, and developed a severe infection second time also and required hospitalization. So beside those 4 cases, this patient is possibly the 5th case. But my part is something different. What I want to tell you, out of some 45 lakh patients that Indian doctors, government has tackled and handled, if the one case is there, that is a stray case. Please do not get panic. Please do not over alarm. What I want to assure you, the citizen of this country, through your important channel and the media, that this could be a stray case, this could be a random case, this could be an exceptional case, this could be an antidoctoral case, and it cannot be defined as a pattern of case. It should not be felt that everybody will have this kind of repetition of infection, a new infection or recurrence of infection or a third COVID type of virus infection. All I want to tell you, out of the 45 lakh patients, those who have been enrolled, treated, managed and successfully saved in 98% cases, one single case should not cause alarm in our ears, but should not cause a panic wave in the country. I want to assure you that government at all levels are very vigilant and very determined to handle all this situation.
All right, a very important point there, Dr. Verma, about the fact that these are very rare instances, because we've got a handful of such anecdotal evidence, some actually established, like the Hong Kong case so far, of reinfections.
So I want to tell you that at the highest level of the government, at the Prime Minister's level, Dr. Harshvardhan, Honorable Health Minister's level, and Health Secretary's level, daily couple of hours are spent on COVID-19, even today, so as to minimize the damage being caused by the COVID-19 to common population of the country, irrespective of whether they are living in Delhi, Uttar Pradesh or Assam. Government is determined to help its citizens in avoiding COVID-19 as far as possible and providing adequate facilities, world-class facilities, each and every patient, whether he's standing in the front of the queue or the last of the queue. But still, this is a fight not of the governments. This is a fight of you and me, of every citizen this country has got. They must remember, no government can fight this alone without the cooperation and active cooperation of its citizens. They must understand the biggest fight is by maintaining a social distancing, medical distancing of 2 meters, using a mask freely, frequently, and not feeling any hesitancy in this.
All right, well, I'm completely out of time. Thank you so much, Dr. Rakesh Verma and Dr. Pratik Patil, for speaking to us on this very important issue. And yes, I think we need to emphasize here that this is a very rare occurrence of reinfection that we've been seeing in Bengaluru.